So let's get right into it. What if I told you that for so many people, their diabetes medications are just not enough? And it might not be the fault of the medicine at all. What if the real problem is that your body is secretly starving for a few key things? Now, just a quick reminder, this is all for educational purposes, so you should always talk to your doctor before making any changes to your health routine. This quote really gets to the heart of it. The idea here is that a few specific, common minerals could be the absolute missing piece of your health puzzle. Without them, your cells are basically screaming for help, and they just can't manage blood sugar correctly, no matter what medication you're taking.
So, this is the big question, right? Could this actually be happening to you? Could something as simple as a mineral deficiency be the real reason behind your stubborn blood sugar levels? Or that constant exhaustion? Or even some of that nerve pain you might be feeling? Let's dig in and see what's really going on.
Okay, so here's the problem in a nutshell. It's what you might call a vicious cycle. When your blood sugar is high, it can make your kidneys work overtime, flushing out essential minerals from your body. But here's the kicker. Losing those minerals makes it even harder to control your blood sugar. You see the problem? You can get caught in this downward spiral where the deficiency makes the condition worse, and the condition just keeps making the deficiency worse.
All right, first up we have a true powerhouse, magnesium glycinate. And that glycinate part is super important. It's not just any old magnesium. Because this form is attached to an amino acid, your body can absorb it incredibly well. It's like it has a VIP pass to get right into your cells where it's needed most, instead of just, passing right through you.
Now, take a look at these symptoms. Do any of them sound familiar? That horrible Charlie horse that wakes you up in the middle of the night? That annoying little eye twitch you can't get rid of? That feeling of just being completely wiped out? So many of us blame these things on age or just a part of dealing with diabetes, but it could actually be your body begging for magnesium. And get this, even that intense craving for chocolate, that could be your body's clever way of hunting down this specific mineral. And the difference it can make when you restore your magnesium levels, well, it's just huge. I mean, look at these numbers. We're not talking about a tiny improvement here. The data suggests insulin resistance could plummet by up to 35%. Blood pressure could drop significantly, and nerve pain could be reduced by up to 45%. That is a total game changer.
So where can you get more of this stuff? Well, pumpkin seeds are the undisputed king, packing a massive 550 milligrams. But you've also got great options like almonds, dark chocolate, yep, there's your healthy excuse right there, and even things like black beans and spinach are fantastic sources to start mixing into your meals.
Okay, on to our second mineral, chromium picolinate. Just like with magnesium, this is a special, highly absorbable form. So what's its job? Well, think of chromium as the key that unlocks the door to your cells. It literally flips the switch on your insulin receptors, allowing all that glucose to move out of your bloodstream and into your cells where it can be used for energy. The warning signs for low chromium can be really subtle. You might just brush them off. That brutal energy crash you get every afternoon, those sugar cravings that feel impossible to control, or that feeling of being hungry all the time, even after you've just eaten. All of these could be pointing to a lack of chromium. And check out the impact of getting enough. The research cited suggests that adding chromium could lower your A1c, which is your average blood sugar over 3 months, by as much as 0.8% in just 12 weeks. Now, if you're managing your blood sugar, you know that is a huge drop.
This chart really paints a picture. We're talking about a potential 48% boost in insulin sensitivity. What that means is the insulin your body is already making just starts working way better. Your cells become much more responsive to it. Now, you can definitely find chromium in foods like broccoli and grape juice, but, and this is a really important point from the source material, modern farming has often depleted the chromium in our soil. That means the amount you're actually getting from food can be a total crapshoot, which is why supplementation sometimes comes into the conversation. Our third mineral is another critical one, zinc picolinate. Did you know your pancreas contains more zinc than almost any other organ? And there's a very good reason for that. Zinc is absolutely vital for making, storing, and releasing insulin. If you don't have enough zinc, that whole finely tuned system just starts to break down. It's so important to be able to spot these signs. If little cuts and scrapes take forever to heal, or if you feel like you're catching every single cold that goes around, even a dull sense of taste and smell. These aren't just random annoyances. They could be your body's way of telling you it needs more zinc, and that deficiency could be what's making your blood sugar so unpredictable.
Now just look at this number, a potential A1c reduction of up to 1.2% in only 3 months. Seriously, this is one of the most powerful effects we've talked about. It just goes to show how incredibly important zinc is for managing your blood sugar.
And if you want to get more zinc from your food, oysters are in a completely different league. But don't worry, beef, pumpkin seeds, and cashews are also fantastic and probably a little easier to work into your weekly meals.
And that brings us to our fourth and final mineral, selenomethionine. This is the best, most usable form of selenium, which is a really potent antioxidant. In this whole blood sugar picture, its main job is to act as a bodyguard for your pancreas, protecting those precious, delicate cells that produce insulin from getting damaged. A selenium deficiency is no joke. As you can see here, it often messes with your thyroid first, which can slow down your metabolism and lead to that frustrating, unexplained weight gain. Muscle weakness, brittle hair, and serious brain fog are also huge red flags that your body is missing this vital protector.
And the power of getting enough is just, wow. A potential drop in A1c of up to 1.4%. I mean, that is an absolutely incredible number. According to the source, a change like that could mean a complete transformation in someone's blood sugar control.
When it comes to getting selenium from food, Brazil nuts are the champions by a mile. You only need 1 or 2 nuts a day to get everything you need. But things like tuna, sardines, and grass-fed beef are also fantastic ways to make sure you're covered. So there you have it, 4 crucial minerals that might just be the missing link in your health journey. The knowledge you've picked up in the last few minutes is really the first step. It's the beginning of a potential revolution for your health, starting from the inside out.
So, let's do a super quick recap of our 4 powerhouses. You've got magnesium for insulin sensitivity, chromium to turn on the receptors, zinc to help make the insulin, and selenium to protect the cells that do all the work. See how they all work together? Each one has a critical job to do.
And that leads us right to the final and honestly the most important question of all. After hearing about all these symptoms and the incredible potential benefits, which one of these minerals really stood out to you? Which one are you going to start looking into first? Just remember to talk about any ideas with your doctor. Your health revolution can start right now with one small, informed step.